So coronaviruses are a family of viruses. So if you take the whole universe of viruses, there are thousands. Coronaviruses are a little family within that whole universe of viruses. And there are 4 coronaviruses that have been in the human population for a very long time. And they come and go each year, causing upper respiratory infections, common colds, and they're generally benign viruses. That is, we may get sick with them, they're an inconvenience, but they're not very severe viruses. The difference with COVID-19 and the virus that causes it, the SARS-CoV-2, is that it's a new virus in the human population. And so prior to early or late 2019, no humans had ever been exposed to this virus in large numbers. And if they had, the virus hadn't been as transmissible as what we're seeing in this pandemic. And that's why it's really a pandemic, because it's a new virus in the human population. So the Omicron variant itself wasn't predictable, but the emergence of a variant is absolutely expected. And we know that as the virus continues to replicate and be transmitted among folks in the world, variants will continue to emerge. So totally expected. Testing as we get into the winter is actually more important than ever, because the winter is the common time where we see lots of respiratory viruses, especially flu, rearing its head. And we're seeing that nationally. We're seeing some outbreaks on college campuses of influenza. The challenge for doctors and nurses is that we can't tell by looking at someone or talking to them about their symptoms if it's COVID, flu, or any one of 100 other viruses that can cause an upper respiratory infection, a bad cold. And if it's flu, it's important to know that, because we have medications that can treat that and get you back on your feet more quickly and avoid the long-term complications of flu, even missing work and school and the like. With COVID, we have a few medications available now. They're not widely available, but they will be over the next several months. And knowing what is COVID, what is flu, and what is neither is very important from the public health standpoint. So the strong recommendation is that anyone who's having symptoms of an upper respiratory infection, or what they think is just another bad allergy attack or a sinus infection, all of those things can look like and be COVID and flu. So we want to encourage testing either in one of the public sites or with your primary care provider, because none of us can tell which virus it is just based on the symptoms. Transmissibility is sometimes a challenge to measure. It's how do you measure that? So it's we always try to compare it to something else, okay? So if we start with the original pandemic strain of SARS-CoV-2, we'll call that transmissibility 1. And what we knew about that virus was that on average, a person infected with that virus would transmit to 2 to 3 other people. Okay. That's that R0 value that we talked about a long time ago, it seems. When we got to the alpha variant was more transmissible than the original virus strain by about 50%. So instead of being transmissibility 1, it was a 1.5. Okay, a modest increase, but easier to transmit. When we got to the Delta variant, that's when we saw a significant increase in transmissibility. And that's what we experienced here in Louisiana and around the country, and parts of the country are still experiencing that. And its transmissibility is more like 4. So we went from 1 to 1.5 with the alpha variant to 4 times more transmissible with the Delta variant. Part of that is because the virus, if a person's infected with the Delta variant, they produce a lot more virus in their nose and in their throat than folks who were infected with the original strains. And we're talking about 100 times more or 1,000 times more. A ton more virus is produced with the Delta variant, okay? And what that means is that when they're coughing or sneezing, they're exposing people around them to a lot more virus. And so this ties into the concept of breakthrough infections that we've talked about. How can somebody who's gotten vaccinated then get infected with the Delta variant. That's what we call a breakthrough infection. And somebody who's vaccinated, but they get sick with a new variant, particularly the Delta variant. So that happens for a couple of reasons. One is because that exposure is 100 to 1,000 times more virus, right? So the virus has a huge head start, even though you've been vaccinated. And that virus lands in your nose or your throat, and it starts doing its job really fast. It's replicating, it's invoking your immune system, all those things. So the memory from your vaccination takes about 2 to 3 days to wake up and shut that virus down. So, but the virus has such a big head start with so much more virus being exposed that you may get sick. The good news there is that even if you do get sick, you're only able to spread virus to other people for a couple of days, because your immune system shuts it down very quickly. That's in contrast to somebody who's not been vaccinated, gets infected with the Delta variant. They will be infectious to other people for a week to 10 days. So is there an advantage to be vaccinated? Absolutely, because even if you get sick, which is, again, lower likelihood, your duration that you're going to spread, the amount of time you're going to spread virus to other people is much shorter. It's only a couple of days. And the breakthroughs happen because of that balance. Our immune system doesn't hang around awake all the time. Those memory cells have to wake up and turn on, and that's that 2 to 3 day lag period when the virus really has a head start with the Delta variant. What we won't know, and we don't know yet, is with the Omicron variant, how much more transmissible is it compared to Delta, Alpha, and the original strain. So we'll know that in time. But it takes time to sort out how much more transmissible it might be. That's different than being more pathogenic or making people sicker, right? We don't have any evidence right now to suggest that the virus is more virulent, is stronger, is able to make us sicker than the original strains. But we do have evidence that it is more transmissible, but we don't know the factor yet. We're all looking forward to gathering for the holidays. This is, everybody wants everything to just be back to normal. And the challenge is now we've got this Omicron variant and we've got flu beginning to circulate in the community. And so I think the important message is vaccination against flu and COVID is the most effective way to reduce risk. Masks work. Masks help reduce risk even further, even if you're vaccinated. And so my general recommendation would be, if you're with a group of people who you're not usually with, outside your family, be prudent. Wear a mask, because we know that a little over half of the local population is vaccinated, which means almost a half are not vaccinated. And so transmission of these viruses can occur even when people don't have symptoms. And so if you want to protect yourself and the ones who live at home with you and your loved ones and the like, wear a mask. That is one of the most effective strategies. We've known that for over 100 years. The other factors that we talk about, wash your hands, maintain physical distancing, are all also important risk reduction strategies. And just be aware of your environment. When there are folks coughing and sneezing, stay away, because they're likely infectious and are exposing you to, or your loved ones to, other viruses and germs that you can get infected with.